My name is Dr. Patel, and today I'd like to educate you about different implant options that you can have for yourself. It starts with a CT scan, an examination of a 3D model of your jaw, which happens on your very first visit when you come and see us. Based on that, we are able to evaluate the density of the bone, we're able to evaluate the amount of bone structure you have available, and make sure you're medically fitted to have these options in the first place. Now, after that, depending on how many teeth that you're missing, there are different options that can be created. First option, let's start with if you're missing one tooth. That option, we call it a single tooth implant, which is most easiest solution that patients have nowadays. This is what the implant looks like. We kind of plant this implant under their bone after we have measured what kind of quality of the bone they have. And this can be done with nowadays with the 3D technology, so we can even do a laparoscopic placement, and that becomes almost like there is no cutting involved, there is no medications or post-op recovery, we call it, involved. And once this implant is planted, the second part of the implant process happens to cover up what's called as an abutment, and the third part comes out what is called as a crown. And essentially from the outside you can only see what's called the teeth or the crown of the teeth, and on the inside you have the actual implant which is planted. Now patients ask me what happens if they are missing more than one teeth. Very simple, that depending on how many teeth they are missing in the arch is one section of the entire area of their jaw, we could plant numerous implants. In this situation, a person is missing 4 teeth to 3 teeth in one side, so we have able to plant in one implant on the front, one implant in the back, similar to the single implant, and then we are able to create, instead of one crown, we are able to create like a bridge. And this is similar to a traditional bridge, but it is attached on top of your 2 implants. But essentially you're getting 3 or more teeth supported by 2 individual implants. So this is your solution if you're missing more than one tooth in one arch. Another option, if you're missing all your teeth, for some reason we are not able to see any of your teeth, that solution we call it total rehabilitation, wherein you have 2 different big options to go with. First, we have the best option, which is called an implant restoration attached with a hybrid fixed zirconia or a metal hybrid. Fancy name, simple way of me telling you, this is the best thing you can have if you do not have your natural teeth and you're missing all your teeth either on the top jaw or the bottom jaw. Essentially, in this solution, what happens is we pretty much take away all your teeth, we make sure your bone is fitted to receive implants, we are able to plant numerous implants, and then on top of those numerous implants, we are able to attach a natural assembly of teeth, which is fixed using fixed screws in the back of the teeth, but from outside they are naturally looking at artificial teeth, but these are the most close look you can have to your natural teeth. The second best solution from this is going to be what's called as a removable solution, which is stabilized with dental implants. In this case, very similar process, we plant numerous implants, but instead of having a fixed prosthesis or a fixed bridge, we are going to attach your regular denture, but we're going to make sure there are prostheses attached to the implant and they click in place. And these are basically your 3 big routes of implant solutions. I get this question all the time. Implant has 3 parts. You have a dental implant, abutment, and the crown. And the total cost between those 3 assembly, it could range anywhere from $1,500 to as high as $4,000 or $5,000, depending on the case. But at our office, we have options that we can custom tailor any of this solution to fit within your budget. So to really understand that question, what patient really want to ask me is, when will they get their final teeth? So this solution happens in 2 parts. A temporary tooth can be given to you the day an implant can be placed, but your implant needs about 3 months to about 6 months of time period. Based on that, your final tooth can be given to you after when your implant is mature. So the whole process to get your final tooth, it could go anywhere from 3 months to 6 months time period. If you can receive routine dental care like extraction, fillings, dental crowns, or dental cleanings, you are a candidate who can also receive dental implants. Yes, there are special situations wherein a medical provider has to check your medical history, and in most of the cases we are able to find a way to able to get you a dental implant. I hope this helps you, and if you have questions or if you feel like this is one of the solutions that can fit you, please go ahead and reach out to us so we can help you better.